We will learn the technique of double-handed knot in this video. What is double-handed reef knot? It is also known as the square knot and is used to secure sutures and is formed by alternating throws in opposite directions. It involves two distinct motions or throws with the hands crossing each time to ensure the knot lies flat and doesn't slip. Now we will learn its technique. Hold the yellow strand which is farthest from you with your middle and ringer finger of your left hand. Hold the red strands that is closest to you in your right hand. Place your left hand index finger under the yellow strand. Now bring your right hand, that is right strand, over your left index finger so that the red strand crosses the yellow strand. Now pinch your left index finger and thumb together. Keeping your thumb and finger pinched, rotate your left hand so that your thumb moves under the crossed strands. Using your right hand, place the red strand in between your left thumb and index finger. Rotate your left hand back to its position in, but still holding the red strand with your left hand. Now let go of the red strand with your right hand. Pull the red loop through and pull both ends, that is red away from you and yellow towards. This is your first throw. Your left hand should still be holding the yellow strand. Hold it with your ring and little finger and loop it around your thumb. The loop should be formed so that from your first throw the yellow thread goes under and around your thumb as in this picture. Hold the red strand to the top. Now bring your right hand, that is red strand, down over the thumb so that the red strand crosses the yellow strand. Now pinch your left index finger and thumb together. Now keeping your thumb and finger pinched, rotate your left hand so that your finger moves under the crossed strands. Using your right hand, place the red strand in between your left thumb and index finger. Rotate your left hand back to its position in, but still holding the red strand. Pull both ends yellow away from you, red toward. This is your second throw. You will have a square knot. Tighten it by pulling both strands evenly. The key considerations in double-handed knot include, first of all, tension. Maintain consistent tension throughout the knot tying process to ensure a secure closure. Secondly, always alternate the direction of loop formation to create a square knot, which is less prone to slippage than the Gynae knot. And another point is practice. Mastering the two-hand surgical knot technique requires practice to develop muscles, memory, and coordination. Now here you can see the technique of double-handed knot. You can see this is the first row and now it's going to be the second throw. Hands are crossing each other's. Now this is another short video about the technique of double-handed reef knot. Here there is no color difference. The overall white thread has been used. This is the first row and now it's going to be the second row. The hands are crossing each other. Another example of the technique of double-handed knot has been demonstrated here. So that was all about the double-handed surgical knot technique. Subscribe on OSCE and Gynae and follow the Facebook page of on OSCE and Gynae.